We serve patients and families. There are our neighbors, our friends, our family. We serve them at a very special time at the end of their life.
Haven Hospice is an organization that provides services to patients as well as their families or patients who are at end of life, doing that in their private home, in a nursing home where they lived, assisted living, or even in the hospital setting. A lot of people think all hospice is the same. I'll run into someone in a grocery store who will see my badge and they'll say, oh, my grandmother had hospice. And I'll say, well, was it Haven or where? Oh, it was in Indiana. They don't realize that they're all very different hospices in the communities. And Haven Hospice is the one that's been in Gainesville the longest and in this area since 1979, and really started as a homegrown hospice of people taking care of their neighbors and friends. Started as a not-for-profit organization and has remained a not-for-profit organization to serve the community.
So we cover 18 counties, going all the way up over to Jacksonville and Orange Park, St. Augustine, and then all the way down through DeLand, and then all sorts of communities in between. This is our largest inpatient hospice center. It's called E.T. York. We have 4 other hospice inpatient centers, and that's often where if they need 24/7 care, they need help getting control of their symptoms, they will come to the hospice inpatient unit to get help.
What hospice does is provide a team of caregivers that are going to really wrap around the patient and the family. That team is going to include a physician that's going to work hand in hand with their primary physician. We're going to have a nurse to come in to help with the medication management, do some teaching, education, work with the family about how best to care for their loved one and whatever their condition is. We also have a chaplain who's going to be involved in the team, and they're going to help with any spiritual needs that a patient or family may have at end of life. And so it really is a team of people that's coming in to help provide care and support and services.
A lot of people who come to us often have their own hospice story. They've seen the impact that hospice makes, and they say, I want to be a part of that. We look for people who are compassionate, who are naturally caring for other people, and who really want to make a difference in the lives of others. And they go into the job knowing that it's not going to be the easiest job you've ever had. But we work with people who know that it's also a great honor to do that. And so we really look for people who want to honor life. And that means honoring it no matter what their background, no matter what their religion, no matter what their socioeconomic status, no matter their political leanings, no matter their sexual orientation. So we really look for people who are going to honor life and honor all the things that make up that person.
Haven provides a number of services beyond hospice, starting with maybe our advanced care planning program, where we have teams of professionals who can meet either individually or in groups with families to talk about advanced care planning. What would their loved one want to happen if they can't make decisions for themselves? So after a loved one has passed on, it's important that a family can access services to help them to process the loss of their loved one. And so we provide grief support to families who've had a hospice experience, but we also think it's important to provide that to the general community at large. We provide Camp Safe Haven, which is an all-day camp for children to come in and express themselves and to process the grief that they're feeling as well, and where they can come together and have a little bit of fun and at the same time honoring and remembering the loved ones that they've lost. And something that I'm especially proud of is the Veterans Program. Honoring our veterans and those who have given so much for us is important to everybody at Haven. And so we do that by recognizing any service member who we have the privilege of caring for. We recognize that they too have a unique experience at end of life. And so we do pinning ceremonies for our veterans, whether they're here in our care center or come to their home, and just recognize and thank them for their service and just help them again through this journey that they're having.
You can go to beyourhaven.org to find out a lot of information about Haven, including all of our programs and services. We have a Haven Hospice Foundation that oversees all of our donations, and people donate in a variety of ways. Sometimes people donate in honor of their loved one. We also have 5 attic resale stores, and they provide a significant source of revenue to basically help with charitable care, unreimbursed care. We don't turn people away. And there's also a number of volunteers in different capacities. We have volunteers who bring their friendly dogs, cats, we've had bunny rabbits. For people who love animals especially, providing that type of volunteer service is so touching to them. It makes such an incredible impact on them. So the opportunities are numerous. Really, if someone has a gift that they want to share, we can usually put it to good use.
99.9% of people don't wake up every day thinking about hospice and end-of-life care. When it's your loved one and your family member, it's hard to be the nurse in that situation or the doctor. By having Haven involved in their care, it's going to allow the family member, the son, the daughter, to be the family member. They don't have to be the healthcare professional. They don't have to know everything that there is to know because we're there. We know what to do, and we're going to help to either teach or to guide or to just walk alongside them through this. And that's why Haven is there, and that they can be the son, the daughter, the husband, the wife to their family members.